great honor today to have a guest here, Dr. Branislav Matej. Dr. Branislav Matej, or known as Dr. Bane, he is a German-born plastic surgeon. He is one of the leading surgeons in Germany, and now he is present also in Dubai for a few years. And he's licensed with the Dubai Health Authority. He's a consultant plastic surgeon. So he will come once in a month to visit here and to do his consultation, to operate, and he will conduct his surgeries inside the German hospital. Dr. Branislav, welcome. And I want to ask you first, how long is your experience? What kind of procedures mostly you're doing?
Well, I'm doing plastic aesthetic surgery since 3 decades in Germany and abroad in the European Union. And since 2016, I'm also licensed, as you announced it now, from Dubai Health Authorities for proceeding surgeries in Dubai.
Yes.
Well, my special part of aesthetic surgery, what I'm doing very often in Germany is surgery of the face, as well as breast surgery in all portion of the breast, and the body sculpturing as liposuction or lifting the body parts after weight loss or something like that.
In our portal, we will present many of your works. First of all, I want to mention that Dr. Branislav is doing serious surgeries. Serious surgeries, when we talk about tummy tuck 360, which is very complicated surgery and very invasive surgery. So you go around the body and you move it full body and you do totally reconstruction of the body. People with overweight, they lose a lot of weight after bariatric surgery. They lost a lot of kilo. You have to repair the body. How you see these surgeries? It's complicated, but for you, it's a daily work.
Well, let's say it's some kind of daily work because there are a lot of overweighted people in Germany, and the trend is to lose weight.
Yes.
So a lot of them are doing it by bariatric surgery. Yeah, so they are doing by bypass.
Same gastrectomy, gastric bypass.
Yes, something like that. So I have a patient that are losing 120 kilo.
Yes.
Can you imagine this?
Yeah, absolutely.
So it means it's a lot of sagging skin of ladies and gents, and it's very interesting surgery, giving a new life for the patient, and I'm doing it very well.
Very good. So we had a patient who had 190 kilo, and now at the moment he's 85 kilo and he wants to be 80 kilo. So already he loses more than 100 kilo. So here, reconstruction of the upper arms, reconstruction of the breast, reconstruction of the tummy, 360 tummy tuck. Also you have to remove the inner thighs and this stuff. How long is taking you this surgery? How long? How many
This kind
hours?
of surgery, what you mentioned now, is very, very complicated because we cannot do it at once. So we make an upper part, let's say the breast and the upper arm in one session. Another session is 360 with a tummy, and it takes me only 6 hours. And the third part is the legs, whatever it is necessary to be done. Most of that is tight lifting.
Yes. First to mention that this job is a heroic job because most of these people, when they make cutting of the stomach, especially the sleeve gastrectomy, they lose the factors for clotting and they have very weak blood, they have anemia, and after anemia they have insufficiency of vitamin B12 and this stuff, and they bleed a lot, and we are facing a lot of problems during the surgery.
Yes.
And that's true. But I saw your work, it's excellent, I can say excellent. I'm also a specialist in surgery and my doctorate is in aesthetics, and I used to practice 33 years now. I'm not practicing because of medical condition, but it's a heroic surgical job to do this kind of surgery, totally reconstruction of the body. When you don't have breast, only the saggy skin, and you have to create new body and to create the new stuff.
That's it.
It's taking 6 hours, 7 hours.
Yeah, depending on what part of the show, but let's say something like that.
How common is the breast implants?
Well, it is a very common, but we also combine breast implants with free fat transfer. It is could be combined with the breast implants or only enlargement with a free fat transfer, depending on what prefers the patient during the consultation, what kind of enlargement she would like to have, and so we do it.
Absolutely. In the new trend, also information for the patient. When they do think about removing the fat from the tummy and putting it in the breast, it's a double income. So she will have good body and she will have breast. So no need implants. And also when you transfer the fat, with transferring the fat, when we have autologous fat transfer, we have a releasing of a lot of stem cells. So mesenchymal stem cells sometimes make the breast to look younger, make the Brazilian butts to look younger, and that especially lady will come on age 40, 45 years. But after fat transfer, it's looking the skin like 15 years. It's a tight, it's younger.
It's very nice. Absolutely nice.
I want to ask you about facelift. It's a great manipulation between the people that they can do a cheap surgery, and that is a lifting, but that is mini lifting, and that. So facelift, it's a facelift. No, you are doing
I
facelift.
totally agree with you, because I really do not like to speak about small lift or mini lift or S lift or whatever it is. Less surgery, less result. Big surgery, when you really want to, you look younger, but naturally younger. It must be done by normal, common facelift with lifting the mass under the fascia, under the skin, and the ladies are looking very natural. That is a kind of surgery that I would see very natural and 10 years younger.
Yes.
It lasts about 5 to 10 years. After that, so we can see.
So if they have good care, but we have to mention to the people that they have to understand it's not mini lifting. This is a face lifting. When you open over the face, you go with general anesthesia. Patient is totally sleeping. It's not possible to do it with local anesthesia. So you remove all the skin and you repair the SMAS, the internal muscles inside, with the caring about blood vessels, about nerves, and that, not to have any side effect, and removing the skin. And this is really very fair surgery for.
Must say, it is the kind of surgery that doing very, very well. Really, I like it because the results are really, really good.
Yes, and this will take long time when you do the facial lift, and that will take. Maybe if you have good care, that will stay 10 years the results. Yes. All right. Also, it's very common when the ladies they deliver the baby, the breast is going down. You put the implants and with facelift, with breast lifting.
Yes, it is mostly what we combine implants with the lifting of the breast. Most of the ladies, as you mentioned, after delivering the baby, they need it.
They lose the part of the skin elasticity, that they don't have elasticity. They have bigger breast after they have small breast, and after they need lifting. So you practice vertical lifting, or you cut part of the skin on the side?
I'm doing a lifting always with this T.
So you go on the lateral side, and you
so what I'm doing
it.
is I'm doing it in a special manner. Maybe it's something new, maybe not. Because I lift the breast with inner bra.
Inner bra, yes. That is very common.
It's very common, but not
yes,
everybody.
Yes.
So that's something that is maybe add on very special.
Yes.
So it takes a little bit of time, but the breast is looking really, really.
Absolutely. This is technique, and a lot of our patient may know that is inner bra. Inner bra. So that means the layers, you have to open it, you have to lift it, and to make the good pocket for the breast implant, and to look like with every time with the bra. Yes, all right.
Also without the bra.
Yes, yeah, without bra to look like this bra. Okay, so Dr. Brane, thank you very much. Thank you very much for your time.
Thank you for inviting me
Yes.
for this nice speech.
And it's a great pleasure to talk to you always, and we will have many topics to talk with Dr. Brane, and we respect his 3 decades work, so 30 years in plastic surgery, it's a long time. So most welcome anytime to
Long time
with
with
us.
good time.
Yes, absolutely.
Thanks.
Thanks again, and we will update you next time with another topic. Thank you.
We hope to see you.